Hello, it is me, Suzi Hanks, and I'm here at Utopia Plastic Surgery and Med Spa, and I'm going in to talk to the infamous Dr. Franklin Rose about facial rejuvenation. I had, about 10 years ago, Dr. Rose did my breast augmentation. Then in 2008, he did my eyes, and now, and then 2 years ago, lipo, and now we're doing a little facial rejuvenation. A little bit off the jowls. Get rid of that. Gonna pull things up. Get rid of the jowls. Liposuction. I'm gonna look 10 years younger, and I'm so excited, and I'm so glad that you're gonna be joining me on this journey.
And then, after surgery, a little Botox in here. We'll do some light lasering to kind of polish and get the skin retexturized. This is what bothers you the worst, right in here.
That
correct?
and the jowls, yeah.
And that's where you'll have just a beautiful result right up and through here.
Great.
And then right up and through here.
Awesome.
So we'll get going. Is just putting in the little marks that we're going to make for this lifting. The face rarely ever gets contaminated. We want you all to just be really. So these are all of the little hidden incisions. So that's one side of the face, what we call marked, and then we turn it over and get this other side. So it's a little bit better than Vaseline, and it just keeps the hair away from. Now what we're doing is injecting a little diluted vasoconstrictor. So I don't know. So what we're going to do is start liposectioning the jowls in this neck area. Take a little bit more. So we're going to take this little scalpel blade and then we'll grab it. Okay, so we made a little baby incision. I'll leave a little baby lipo cannula. So now what we're going to do is section away the fat in the jowl area and see that's a little bit of the fat that we're getting out from the facial. Now we're going to make a little baby incision and get this neck down a little bit more. And we're going to lipo in through here on this right side. So what we've done, Bovie forceps. What's our Bovie at, Terry?
30.
Good. So now what we've done is we've made a little incision. See, you'll never see that scar. Okay, and 15 right? So now you can see she's perfect here. Right behind is what's called the tragus. What we've done is you can see the extent of the flap we've undermined. We've defatted in here, we've defatted in there. So here's the extent of the undermining underneath her skin. We've gone just like the edge of neck muscle. We've put in several little sutures to elevate up the neck like this. Now we're going to make sure we've gotten all the little bleeders, and then we're going to actually lift the skin, thus completing the face and neck lift. So now this is probably the more, I guess you'd say, painstaking portion of the operation, but certainly one of the most important, like that one, is to get all these, see, come and look, you can see these teeny little bleeders, but any one of which are not bad in and of themselves, but together they could accumulate. She's certainly a young age spectrum for this. So here's the flap that we created, and now we're going to lift away. Can you see that, Bill? That's what we've done. Now we're going to go from here to here and make a beautiful and gorgeous thing. Okay, and a little. So, but this is hidden. You see, that's hidden, and that's behind the ear. I mean, me give you a good picture in a second here. How about a real nice moistened lap, please, Susie? You can see how nice, and if you get right here, see how nice and smooth, and then look at how wrinkly and old that side is. So you can see side A, and this is up and lifted and beautiful, and this is still old and aged. So that's, even at this rather young age, it's old and aged. So let's get all the blood off, beautiful and smooth and old and aged. Now you can see her cheekbones. See, when we do this technique, it brings out their cheekbones. This is sort of melted in fat, and now she's got a beautiful high cheekbone right up in here and a beautiful mandibular line, and that's what everybody wants, is that beautiful mandibular line, a nice elevated cheek area compared to that old aged tissue. But we're going to get that youthfulized very quickly.
Hi, it's me, Susie. I'm out of the OR. It's the day after. I just had facial rejuvenation from Dr. Franklin Rose, Utopia Plastic Surgery and Med Spa. I feel great. I feel like I have the tightest ponytail in the world, and somebody's dangling me off a high building with it. But other than that, I feel really good, and I am going to be heading home here in about an hour or so, and I'll be back to work on Wednesday. So it's been an incredible journey, had a good night, slept good. I just feel dynamite. Who would have thunk? Thanks, Dr. Rose.
Hello, Susie.
Hello,
How are you?
Ready?
Don't you look fabulous?
I
You
feel so good. Thank you so much.
You look like a supermodel.
It's totally amazing. I can't believe that it's only been 6 days.
5 days.
5 days.
Today is post-op day 5.
Wow.
So Cassie's gotten out your first set of
Wow.
sutures. You're ready to go back to work tomorrow.
Yes.
These stitches and these stitches will come out on Monday.
Okay.
And these stitches are out down under here.
Mm-hmm.
And so there's still a little puffiness. Obviously at post-op day 5 it's puffy here and puffy here a little bit. So we'll show you what to do at night to keep like a little garment. That'll kind of get the puffiness to go away. But
Okay.
you can really, it's brought up your cheeks beautifully, and now you've got a beautiful, gorgeous line here and line under here. Just a little puffiness here and here. That'll go away in probably another week to 2.
Not one bruise.
No,
Not one single
bruising
bruise.
at all. Post-op day 5, you're doing incredible.
Yeah, it's been amazing.
Aren't you? Yeah, it looks just beautiful.
You are a genius.
Well, you're a good patient, and Cassie is a good nurse.
Yes.
And, yeah, it looks just
Hi,
very.
Suzi Hanks. Okay, post-op day 5. I had a facelift 5 days ago. I feel fantastic. I have had the most incredible experience, and I want to thank Dr. Franklin Rose and Utopia Plastic Surgery and Med Spa. From the very first day, I haven't had any bruising at all, a little bit of swelling, no real pain, a little discomfort. The first night I stayed in the hospital, and it was a wonderful experience from day 1, and he is just amazing and an absolute genius. I'm so excited to watch every day the swelling goes down. Every day I look better. It's still very fresh. It's going to be softening up and looking beautiful, but I am more than thrilled with all of the results. And I want to say again, thank you very much, Dr. Franklin Rose and Utopia Plastic Surgery and Med Spa. You're amazing.